Okay, 3, 2, 1. Welcome back. All right, now we're going to talk about dopamine. Dopamine is a key neurotransmitter system in psychiatry. We're going to talk about where it comes from, and we're going to talk about the 4 different dopamine pathways, which is going to become very relevant when we get to content about antipsychotics, and talk about which drugs work on dopamine pathways. Now, dopamine is synthesized from L-tyrosine, which is an amino acid. It is made. L-tyrosine is then made into L-dopa. L-dopa is then converted into dopamine, and as you can notice, dopamine then goes on to become norepinephrine. So this same pathway generates a lot of different molecules in the body. But understanding that this is from the amino acid phenylalanine, which is where L-tyrosine is made from, and then goes on towards to be dopamine. So dopamine plays a lot of different roles in the human body. In the central nervous system, which is our area of greatest interest, of course, it has a big effect on mood and attention. And when overactive in certain regions, can account for some of these symptoms that we associate with psychosis. It is also a key neurotransmitter for movement, because we see the deficits of dopamine and other pathways when we look at somebody with Parkinson's, but also in cognition, and specifically in craving and reward. So we know that this plays a big role in addiction, because really anything that feels biologically satisfying is rewarded with dopamine. So when we're thirsty and we take a tall glass of water, we probably get a little sparkle of dopamine in the ventral tegmental area of the brain where reward is registered. In the peripheral nervous system, dopamine, of course, has an effect on blood pressure. You know that if you've ever been in an ICU. And dopamine has an effect on prolactin release, which is relevant to some of the side effects of antipsychotics. It is broken down by monoamine oxidase, and there are 5 different dopamine receptors. The one that gets most of the credit, most of the interest, I should say, in psychiatry is the D2 site, but watch this space, that may change over time. But you can see how dopamine starts there at the ventral tegmental and substantia nigra, and then branches out through the rest of the brain through these dopaminergic pathways. Now, I mentioned these pathways, and so you can see that they all originate in roughly the same place, but there are 4 pathways, and this is something that people learning this often struggle with a little bit, but it helps to understand how they relate to different disease states. So the mesolimbic pathway is what contains, so meso refers to middle or older, that's that midbrain connector to the limbic areas of the brain. So the areas of the brain that are responsible for emotion, to some extent memory and attention. Now, these are, we believe that when the dopamine is overactive in these areas, then you get psychotic symptoms. So one of the targets of antipsychotics, particularly atypical antipsychotics, is to try and dampen down dopamine activity in this region of the brain. Now, the challenge of that is that in the mesocortical tract, which is a much broader spread, so that's coming from the midbrain all through the prefrontal cortex, all the way back to the rear of the brain, particularly in the prefrontal cortex, this has a lot of influence over cognition. So if we don't have enough dopamine activity here, we get problems with inattention. And this is why we use amphetamine stimulants to increase dopamine, because particularly in the prefrontal cortex of the brain, it's thought that that increases some of the ability of the brain to filter extraneous information and to pay attention. Now, moving our attention to the right side of the slide, the Niagara striatal area of dopamine. Now, this is, we talked about this as being relevant to Parkinson's disease. So the dopamine in regards to skeletal muscle movement has to do with smoothing and coordinating motion. So when we have deficiencies of dopamine in the Niagara striatal pathways, we get this characteristic stiffening and incoordination, bradykinesia, that we see in Parkinson's disease, and we can see as a side effect of dopamine blockade from antipsychotic medications. And then finally, looking to the bottom right, tuberoinfundibular tract, the tuberoinfundibular tract. What this is a very small tract between the midbrain and the pituitary, where dopamine, when dopamine is present, it inhibits the release of prolactin. So when we block dopamine, we can get prolactin release. When we get prolactin release, we get milk production and gynecomastia in males, or galactorrhea even in both male and female identified patients, which can be very problematic, particularly with some of the older antipsychotics and even some of the newer medications such as Risperdal, which tend to block dopamine in that pathway as well and create that side effect. So when we have excessive dopamine, as we might see in somebody who is intoxicated on amphetamines, there might be everything from sort of pleasure-seeking behavior and increased attention to the sort of hyper-alertness and paranoia, all the way up through psychosis. You can see excessive motor activity in the form of tics and such, that when there's excessive dopamine present, and when there's perhaps not enough dopamine in certain areas of the brain, such as the frontal lobes, we see this poor impulse control and difficulty with attention and stimulus. And in other areas of the brain, such as the nigrostriatal tract, we can see Parkinson's symptoms from a absence of dopaminergic neurons. So as I mentioned, ADHD meds, particularly specifically the stimulants, are potent releasers of dopamine and also prevent its reuptake. So they act in the same way that an SSRI does on serotonin, except they're having that same effect on the dopamine reuptake pumps. A very few number of our antidepressants work on inhibiting that same reuptake of dopamine, particularly bupropion has some dopamine reuptake inhibition. But most important, most of the time when we're thinking about dopamine, we're thinking about antipsychotics. And these antipsychotics, as we'll talk about in later content, block these dopamine receptors to varying degrees. And when we're treating Parkinson's disease, often we're trying to stimulate the dopaminergic system, either directly with L-DOPA or with dopamine receptor agonists, such as pramipexole. So in summary, dopamine is created from tyramine and from phenylalanine and is the precursor to norepinephrine and epinephrine. It does many things in the brain through these 4 different pathways. And there are times when blocking dopamine activity in certain areas of the brain, such as in psychosis, can be therapeutic. But that same drug, which is also now blocking dopamine in other areas of the brain, such as the nigrostriatal pathway, can lead to side effects such as Parkinsonism. And that we try and target these dopamine receptors as specifically as possible with antipsychotic meds. And we try and activate these systems in a mild way with attention improving drugs such as amphetamines. Thank you.